talking very simple. I'll be speaking very simply. No medical terminologies. I'll keep it as simple and as clear-cut as possible. Now, what I will be discussing with y'all for today is about fevers. What are fevers? When do you get fevers? Why do you get fevers? And what to do when you get a fever? I will be discussing three specific types of fevers, three specific types of diseases. One is dengue, which is a very common condition, but something that becomes very complicated for most people because of the confusion that they have with it. After that, I will be talking about respiratory infections, basically colds and coughs, and then urine infections. Now, the reason why I'm talking about these three is because these are the three most common infections that we all tend to have. And there are certain things that y'all could do at home and certain rules that you could follow, which would make it much easier for the doctor who is treating you to make the treatment a little more streamlined. Now, a couple of things to note. This is not going to make you an expert in fever. So please listen to your doctor. Don't go to your doctor and say, no, I attended a talk and this is what the doctor said. No doctor is going to listen to that. And most of us have a little fragile ego. So if a patient tends to say that, we tend to get a little And this talk is more of a guideline. It is not hard and fast rules, because everything with medicine is not a hard and fast rule. Everything that we practice is a guideline. We decide when and what to do. So whatever is mentioned here is not a hard and fast rule. There are certain times your doctor will definitely do things differently based on what he will see in y'all when y'all do go there as his patients. Now, coming to fevers, basically what they are. When do you say that a person has a fever? Now, you say that a person has a fever only if the temperature is more than 100 degrees. Now, 100 degrees when you measure where? There are mostly three sites where you can measure the temperature. One is in your mouth, one is under your armpit, and then the other one is the one that is used for very small children. That is, you measure it in the anal region, that is in your bum. Irregardless of where you're measuring the temperature, a cardinal rule to follow is if it is more than 100, consider it to be a fever. There are certain places where they say that the temperature under the axilla shows 1 degree more or 1 degree less. There are things like that. But as a guideline, I keep it very simple for my patients. So wherever you measure, if it is more than 100, that is a fever. A temperature more than 102, you would say, is a high fever. And a temperature more than 103.5 is something that you need to look at a little more immediately rather than sit around and wait. Like, okay, the doctor is going to come at 6 o'clock in the evening. It is only 4 o'clock. We'll sit and wait and see what to do. That is not what you have to do if the temperatures are crossing 103. Now, is there a difference between the fevers for children and adults? Typically, no, because the treatment more or less is the same. If a child has a fever, you treat it the same way. If an adult has a fever, you treat it the same way. The only thing that you have to be careful about is one point, which is why I've put it as yes. And that is for children who are less than 5 years of age. Now, children of less than 5 years of age throw something called a febrile seizure. Now, a febrile seizure is a seizure that happens in children when they are having a fever. If a child has a seizure when there is absolutely no fever, it is very unlikely to be a febrile seizure. So what you have to do, this thing is, when you have a febrile seizure, you have to tell the doctor very clearly that yes, the child had a fever and then the child had a seizure. One very important rule that you have to remember, most children, many of y'all have grandchildren, many of y'all have small children. When they get these febrile seizures, it is nothing to be worried about. This is not going to turn into epilepsy, which is where you need to be treated for seizures. where it is a condition that will continue sometime for a lifelong duration. Febrile seizures, typically for all children, stop by the age they are 5 years old. The minute they cross the age of 5, they are perfectly fine and very rarely get a febrile seizure after that. The reason why children of a small age get a febrile seizure is because some children, not all children get it. Some children, what happens is the brain cannot tolerate the switch in temperature when it goes very high. So when it goes very high, the brain suddenly gets a little bit of a shock, like, oh my God, what's going on? And it throws a seizure. When do you have to panic about a fever? Never. There is absolutely no reason for you to panic when you're having a fever. Simple and general thing that you all must remember is a high fever does not mean a serious infection. It just means that your body is reacting a little more violently to whatever is irritating your system. So a high fever does not mean you have to run helter-skelter, lose your head about, oh my God, it's a high fever. Because as I will show you later, patients who come with dengue, they have a disease as dangerous as dengue. They come with temperatures of about 100 to 101. But we have patients who come with a simple urine infections with a temperature of 103, 104. So it does not make a difference. Now, what are the typical causes for fever? Fever comes for a variety of reasons. A fever is a very non-specific symptom. Majority of the time, yes, it does mean that there is an infection. But there are other reasons also why you can get fevers. One is the main cause is an infection. Yes, you have an infection, you will get a fever. Now, by infection, I mean it doesn't matter whether it is a bacterial infection, a viral infection, whichever sort. When there is an infection, you will throw a fever. Stress. Now, if you're in a place where it is very hot, you've all heard of heat strokes, where patients in the heat, they suddenly collapse, they rush to the hospital, their temperatures are very, very high. That is a fever, high temperature, but it does not mean that that is an infection. That is for some other reason. The same thing happens in extreme heat, extreme cold, physical exertion. I'm sure many of you all, especially more of our senior citizens, you all will notice when you all travel for long distances by bus, you all are bumped up and down in the buses and all that, go home, you feel like you're having a fever, you get a fever, you all take a Dolo, go and sleep, and in the morning you're fine. So that also tends to happen. Emotional trauma, loss in the family, overwhelming emotional depression. It can sometimes spike a fever for no reason. Allergies. Very rarely, sometimes doctors do say that yes, an allergy can spike a fever, but then again, that is a rather rare cause. Drugs. Drugs are another reason for people having fevers for no real reason whatsoever, especially in children. Many children, especially some of them who come to my clinic who have been treated outside and then they come, they say they have been having fever for 6 days, 7 days. They have done the blood test, everything is normal. And then I do something called a drug review where I go through all the medicines that have been given and I notice they've been given a lot of medicines. So I tell them to stop all the medicines, wait for 48 hours. The fever goes. These type of reactions are called drug-induced fevers. Basically, the drugs themselves cause a fever. It not only happens in children, it also happens in adults. So if at any point in time you notice that someone in your family is having fever for a long time, doctors are giving injections, they're giving medicines, fever is not going away, ask the doctor if maybe can we just stop all the medicines and wait for 2 days and see. Invariably, after 48 hours, the fever goes away. And if it does, then you have nothing to worry about. Now, I'm going to be talking about the fever that comes with infections. Now, I'm sure many of you all have seen, some of you all get a fever where you suddenly feel a little tired, you'll get a little body ache, and then suddenly you have a fever. Sometimes you start shivering. You start shivering uncontrollably. You put 3 blankets, you're not feeling warm, you're feeling this thing. Then the shivering stops after a while, and then suddenly you get a high fever. So basically, you have fever with shivering and fever without shivering. Now, what is the difference? If there is something infecting the body, whatever infecting the body, either a virus or a bacteria. If the virus or the bacteria wants a higher temperature, it releases a chemical that affects the thermostat in your brain, that affects the control center of your brain, and it makes the body temperature go up without anybody's knowledge. That is when you get a fever with no reason at all. As in, you have the body pain, you feel tired, and then you get a fever. On the other side, suddenly you have this thing where the body realizes that, oh, there is an infection. I have to fight the infection. So how does the body fight the infection? It raises the body temperature to fight the infection. Now, the only difference is when the body is trying to raise the temperature, you get the shivering. So you get the shivering and then you get the fever. And always remember, the body is a very efficient machine. So when it is trying to raise the temperature with your shivering, you are going to get a very high temperature after that. Invariably, when you have shivering, there is going to be a high fever coming after that. So when you do start shivering, you can take something for the fever to make sure that the fever doesn't go up too high. The treatment does not make any difference between the two. Now, common causes for fever with shivering, that is, you have shivering and you have fever, many of you all know. Most important is a urine infection. The second one, everyone, especially our elderly, will know, malaria. And the third one, when there is shivering with high fevers, is if there is pus in the body. Basically, if you have a boil with a boil with pus inside, you get the infection around the fingernail, which is a rather severe one. That time you can get the shivering with fever. Now, coming to children. Now, managing the fever for adults is very simple. You have a fever, give them a Dolo, the temperature comes down. That's it. But for children, you have to be a little more careful. With children, normally what I demarcate for my patients is if the temperature is more than 100 or if the temperature is more than 100.5. Those are the two temperatures you must remember, 100 degrees and 101.5. If it is more than 100 degrees, you give paracetamol, plain paracetamol, and the dose is 15 milligrams per kg of the body weight per dose, which means if you have a child who is 20 kgs, that means 15 into 20, that is 300. So you need to give 300 milligrams of paracetamol per dose, which means every time the child has a fever of more than 100, and if the child is 20 kgs weight, you have to give 300 milligrams of paracetamol every time. It can be given anytime there is fever. There is no restriction on you cannot give it now, you cannot give it then. There is no relation to food. So if the child has not had lunch and the having fever, no problem. You can still give the paracetamol. It doesn't cause an issue. And paracetamol can be safely given up to 6 times a day, which means every 4 hours. Now, if the temperature is more than 101.5, many times when the temperature is more than 101.5, for example, 102, 103, paracetamol takes a little time for the temperature to come down. So for that, we have an alternative drug called mefenamic acid. Now, mefenamic acid is present as it's a very common syrup. I'm sure many of you who have children know it. It's a syrup called Meftal-P. Now, this one you have to give 7 milligrams per kg per dose, which means if it is a 20 kg child, you give 7 into 20, 140 milligrams per dose. This also can be given up to 6 times a day. Again, can be given anytime if the temperature has gone up. Now, say you have a child who has a temperature of 100. You are given paracetamol. After 1.5 hours, you notice the temperature is 102. Don't worry. You can give the mefenamic acid. But you check the temperature. It is already 102. Don't give the paracetamol. You can just give the mefenamic acid because that will bring the temperature down faster. This is the rule for children. And again, no relation to food. Now, you know that most of the fever syrups in children come in two strengths. They come in either 120 milligram syrups or 250. Now, there are certain companies like the company that produces Calpol. They give it at 150 and 250, more or less the same. It is nothing great. The only difference is now in the 120 syrup, it means 5 ml of that syrup, 5 ml of that syrup has got 120 mg of paracetamol. So if you have a child for whom you have to give, say, 60 milligrams of paracetamol, it means the 120 mg syrup, you have 5 ml has 120 mg, but you have to give 60 mg, which is half. So you do not give 5 ml, you give 2.5 ml. It goes that way. Similarly, with the 250 mg, it means 5 ml of that syrup has got 250 milligrams of paracetamol. So like I had given you the example of the child who is 20 kgs. If you want to give paracetamol, it becomes 300 milligrams per kg, 300 milligrams per dose, I'm sorry. So for that child, you can give 5 ml of paracetamol. Now, this is another very important thing that you can do for fever, and that is called tepid sponging. Now, tepid sponging basically means you run water on the external surface of the body to bring the fever down. That's it. You help it by you put water on the body, the water evaporates, and when the water evaporates, it takes away the fever with it. It takes away the excess body heat. That is how it works. It can be done for any age group. This is not just for children. Now, even adults, y'all are having high fevers. Y'all taken a Dolo, not feeling comfortable. Go have a nice warm water bath. The temperature comes down. For children, make them lie down on the bed, take off their clothes, and then take water in a basin or a bowl. Do not use ice water. Do not use cold water. It should be a little warm, lukewarm water. You should not use cold or ice water because if you are cold, what happens? You start shivering. And what did I say? When you start shivering, what happens to your body temperature? It goes up. So if you're using ice water and you make the patient start to shiver, the temperature is going to go up even further. So do not use cold water, warm water. And you have to keep wiping the body. Do not do that old thing that our old generation put one putty on the head. Doesn't make a difference. Take off the clothes, take a cloth, put it in the warm water and keep wiping the body. Keep wiping for 10 minutes. The temperature will come down. Major sites that you have to focus when you are doing it is the neck, under the armpits, and around the private parts. That is because those are the places where the biggest arteries are at the surface. So if you wipe at those areas, the temperature comes down much faster. You wipe the whole body, but concentrate on these 3 areas. 10 minutes and the fever comes down. Now, coming to the specific infections, dengue. Dengue, when everyone hears, the first thing they go is, oh my God, this is dengue. Dengue is, yes, it is a dangerous disease. It does have its own dark history and dark stories that do go around. But I will talk you through about dengue. I will explain what is the complications that come with dengue and what is the way that you manage dengue. Because honestly, for me, dengue is the easiest thing to treat in my clinic. It is one of the simplest things to treat. And I'll tell you how. This little ball of color is the dengue virus. It is just that, caused by a virus. So it is not a bacteria, it is a virus. As you all know, it is transmitted by mosquitoes, a very fancy named mosquito called the Aedes aegypti. Nothing to do with Egypt, as much as I love Egypt. Now, yes, many people say that this is the mosquito that bites during the daytime. Doesn't matter. Just stay away from all mosquitoes. It doesn't mean that you run away from mosquitoes in the daytime and then you allow the nighttime mosquitoes to bite you. Whatever said and done, protect yourself from all mosquitoes. All right. Now, what are the symptoms for dengue? The symptoms of dengue, we all know. Fever. Is it a high fever or is it a low fever? Doesn't matter. It's a fever. I told you. The temperatures don't matter. High fever, low fever, doesn't matter. It's a fever. More than 100, it's a fever. Severe body and joint pain. Now, this is a little subjective. Subjective in the sense, many of you women who are married, you all have husbands. You all know your husbands. They have a little bit of a cold and a cough, and they act like they are dying. They cannot get up. Oh my God, I cannot move. This is typical. All men are like this. So they will say, oh my God, I'm having body pain and this and that. It's not that. This is a real severe pain. Severe pain in the sense, it is difficult for them to get up and walk because of the pain. The pain is so severe that they cannot walk. Here, the problem is there are people who have different pain tolerances. Now, we have people who can tolerate a lot of pain. Some people who can tolerate no pain. So the easiest way for me to demarcate is I ask them, is this the normal pain that you get when you have a fever, or do you feel like it is more than what it normally is? Now, typically, most of my patients say, no, that when I have this body pain, I always get, I can't, then I know it is not dengue. But if they say, no, it is really too much, I don't know, I've never had pain like this, it is really bad, then I start to suspect dengue. Fatigue and tiredness. Now, fatigue and tiredness comes for all infections. Anytime you have a cold and a cough, anytime you have a fever, you are tired. But with dengue, it tends to be a little exaggerated. The thing with dengue, you must always remember, is everything about it is exaggerated. The fever is a little exaggerated. The body pain is exaggerated. The fatigue is very tiring. So for children, if children are suspected with dengue, my only question that I ask the parents is, have you had to tell your child to sit quietly? Are they running around and playing, or are they sitting quietly in a corner? And if the children are sitting quietly in the corner and they are not walking around, they are not moving around, then I suspect that this has to be dengue. The other thing that does happen is rashes. If the Miss Kala Peters, could you please mute yourself? Okay. Then the other thing that happens is a rash. I will show you what type of rash. Now, the rash is not something that is very easily identifiable. It is more for people who are fair. So our darker skinned individuals, it is going to be a little more difficult. However, with doctors, we tend to figure this out. So typically I tell my patients is if your relative is looking a little more pink, then we need to think about dengue. Nausea and vomiting. This tends to happen with quite a few of my patients who have dengue. They get nausea for no reason at all. It's got nothing to do with the stomach. But they have fever, they have got body pain, they're very tired, and one or maybe twice they might vomit. Now, this is the rash that I was talking about. Now, if you can see, can you see that this portion of the skin is red? But over here, it is white. Now, this white is where the examining person has pressed 4 fingers, and the fingers have left a mark. This type of rash typically tends to warn us that this could be dengue. It doesn't mean it is dengue. You get rashes for 1,000 reasons. But you have to keep in mind that if this happens, it can be dengue. So don't run to the doctor saying, he has a rash, this is dengue. No, it is just a warning. It is just a sign that it may be. There is another rash in dengue that will come. I will be talking about it. That I will speak about a little later. But this is typically the rash that tends to come within the first 2 or 3 days when they start having dengue. Now, what are the tests that you do for dengue? Not a lot of tests. One, you do your complete blood count. That is basically a CBC. Now, in the CBC, the thing that is the most important are these two. That is your platelet count and your PCV. Now, PCV means packed cell volume. All right. Some labs will give the report saying PCV. Some will give it saying hematocrit. They are exactly the same. These are the two things that are very, very important in dengue. And I will explain to you later why. Then, of course, you have the dengue profile. That is the dengue test, where you test for 3 things, NS1, IgG, and IgM. I will explain about that in a little bit. The dengue test, you've got 2 types. You've got the ELISA test, and you have the rapid test. Now, the ELISA test is a slightly more longer test, so it takes a little longer for the reports to come. The rapid test, obviously, as the name is a rapid, so it comes fast. Not much of a difference between the two. It depends on each doctor. Some doctors say, no, I don't depend on the rapid test. I prefer the ELISA test. There's a significant difference in the rates of the tests, so to each their own. Then there is the liver function test. Now, this is the thing about dengue. Now, I've seen a lot of doctors who do the liver function test and then they say, oh, the liver is strained and this and that. Dengue is a viral infection. Typically, most viral infections affect a lot of systems in the body. Along with that, with dengue, almost all of our patients, the liver functions are going to be abnormal, which means 2 values, that is the liver enzyme markers, they will be on the high side. Now, what happens is many patients, when the doctors do this, they say that, this is there, so there is jaundice, the liver is damaged, so they stop telling the patient to eat. They don't give the patient food. Okay. And that is also very important for why I'm coming to later. So the liver function tests do not need to be done. You just need 2 tests. Your complete blood counts, including your platelet and your PCV, and you need your dengue profile to see if you have dengue or not. Now, in the dengue profile test, you have got 3 reports that come. One is an NS1, then you have an IgM and an IgG. All right. Do not bother about the expansion. Just remember NS1, IgM, and IgG. Now, what does that mean? If your NS1 test comes positive, it means you have a new dengue infection. So if your NS1 is positive, it means you are within 1 to about 4 days since you have started having dengue. If your IgM is positive, it means you have had dengue for the past 5 to 10 days. And if your IgG is positive, it means you have had dengue anytime between 7 days to 1.5 months ago. Now, why is this important? Say you have a patient who comes and then we do the test. The NS1 is positive, IgG is negative, IgM is negative. As you see here, it means if the NS1 is positive, it means he's having a brand new dengue infection. Now, say he comes, the NS1 is negative, the IgM is positive, and the IgG is negative. Then it means he has had the infection for the past 4 to 5 days. And it has crossed 5 days, which is why the NS1 is negative, but the IgM is positive. And if they come with both of these negative, but the IgG is positive, then it means he's had the infection for the past 7 days. Now, why do we need to know this? Very simple. If the NS1 is positive, the platelet counts are definitely going to come down. If the IgM is positive, the platelets may or may not come down. If the IgG is positive, the platelets are never going to come down. That is the important thing. So if your NS1 is positive, your platelets will be coming down. If the IgM is positive, they may or may not. And if the IgG is positive, they are definitely not going to come down. So if you go and do a test and you get the IgG positive, you don't have to worry about the dengue because the dengue is done and over with, depending on what your platelet count is. Okay. Now, sometimes you get a mix of those. I've had some patients who come with the NS1 and the IgM positive. That is because their infection was between 4 to 6 days. So that time the NS1 and the IgM is positive. I had one particular patient who had come where the IgG was positive and the NS1 was positive. I actually thought the lab was wrong and I did the test twice. And the second time also it came exactly the same. So the IgG was positive and the NS1 was positive. So what does that mean? He had dengue maybe a month ago and he got a new one. So this is very important for you to remember. NS1, new infection, IgM, about 4 days old, IgG, more than 1 week. So NS1, platelets will come down, IgM, platelets may come down, IgG, platelets won't come down. Now, I'm going to take a little time to explain things here. I do not want you all to look at this temperature bit. I do not want you all to look at potential clinical issues. I want you to look at laboratory changes. Now, I told you in your blood test, you are going to have 2 tests you're supposed to look after. Your platelet count and your hematocrit. That is your PCV. Now, with a normal dengue infection, this is what happens. On day 1 of your infection, your platelet is high. By day 2 or 3, the platelet starts to come down. 4th or 5th day, the platelet starts to go up again. All right. You have to remember this. Once you start the fever on the first day, now typically we will do the dengue test somewhere on the 2nd or the 3rd day. Now, when you do it on the 2nd or the 3rd day, can you see the platelet is already coming down? So there's nothing to worry. We know it is going to come down. Now, day 4 and 5, it is going to be on the low side. But after the 5th day is when the platelet starts to go up. So typically what we normally need to do is we check the platelets and the PCV at this date. If the platelet count is high, if it is more than 1 lakh, you do not need to repeat it every day. Repeat it again after 6 days, provided the patient is fine, and the platelet will go back up again. If you repeat the platelet here, it is going to be low. So even if you repeat the platelet down and the platelet is coming down, you have nothing to worry about. But you also have to keep a watch on the hematocrit. That is the PCV. Now, why? If your platelet count is coming down and your hematocrit, that is the PCV, is going up, that is not a good combination. So if your platelet count is coming down and your PCV is low or it is remaining the same, no problem. But if your platelet count is coming down, but your PCV is going high, then you have to be a little careful. The normal value, now what I mean by high is this. Now the normal value for PCV is typically in an average lab, it is about 35 to 45. That is the normal PCV value. Ballpark figure, there are variations between labs. Now say on the 2nd day when you do your platelet count, the patient's platelet count was say 1,50,000. The hematocrit was 36. That is well within the normal range of 35 to 45. Now, on the day 4, the doctor decides to redo the platelet count. The platelet count from 1,50,000 has come down to 80,000. People start to panic. Oh my God, platelets have come down. What to do? What to do? This is where you look at this. This is where you look at your hematocrit or the PCV. Now, if previously it was 30, I said 36, it was 36. And today the PCV is 38. No problem. It has more or less remained the same. But say it was 36. The platelet count was 1,50,000. It has come down to 80,000, but the PCV has gone up to 45. Then there is a problem. That is when you have to be much, much more careful. And your doctor will also be more careful. He will start telling you that, see, you have to take more fluids. You have to check your platelet count again. So if your platelet count is coming down and your PCV is remaining normal, remaining the same, no problems. Even if the PCV is coming down also is no problem. Say you did on the first day, your platelet count is 1,50,000. Your PCV at that time was say 42. The next time you did, platelet is 80,000. PCV has come down to 35. No problem. Platelet goes down and the PCV goes up. That is when you have to be a little more careful. And as you notice, by the time it crosses 5 days, you see the hematocrit, the PCV is already coming down and the platelet has already started to go up. And once with dengue, once the platelet starts to go up, there is no worry. This is very, very important. You all must remember this. Platelet coming down, PCV going up is not a good thing. Now, by going up, I mean it should go up by more than 5, by a factor of 5. So it was 35, it should go up to 40, then yes. 35 going up to 36, not a problem. What is the treatment that we give for dengue? Paracetamol. When there is fever, more than 100, you give paracetamol. Dengue is the only place where you will not use mefenamic acid. You will only use paracetamol for the fever. High fevers, you will use tepid sponging. That's it. No antibiotics. Antibiotics are not given for this for the simple reason that it is a viral infection. A viral infection does not require antibiotics. Antibiotics are for bacterial infections. So no antibiotics whatsoever. Absolutely no painkillers. No taking Hyphenac, no taking Combiflam, no taking Brufen, nothing. If you're having pain, bear it or take a Dolo, paracetamol, more than enough. Nothing more to do. Some doctors will give a vitamin tablet. I usually prefer giving a vitamin tablet because it helps the patient feel a little more energetic. Sometimes the patients have acidity. Yes, give something for acidity. Pan-D or Omes-D or something like that can be given. No problems. Diet, what to give? Anything. They want biryani, they can have biryani. No issues. Because the better they eat, the better their immune system, the better their strength, the better the recovery. Patients typically with dengue, they tend to have a loss of appetite. They don't feel hungry. So I'm very strict with my patients. I tell them, you have to eat plenty of fluids, fruit juices, tender coconut water, drink well. You must drink a lot of fluids when you're having dengue. Lots of fluids. And eat properly. If you're not hungry, have a little bit. Wait for an hour, have something more. But you must eat. That is very, very important. Fluids, like I said, fluids are very, very important. So basically, all that you need is something for the fever, which is paracetamol, maybe a vitamin tablet, something for acidity. That is all. Now, the diet part of it, now, like I told you, they will do the liver function. They say, oh, liver is strained. Don't give oily food. Don't give salt in the food. Don't give this. Don't give that. Give. Nothing happens. Let the patient eat well. They will recover well. Papaya leaf juice and kiwi fruits. The biggest headache for us. Now, papaya leaf juice. None of y'all are going to go outside, pluck a leaf and eat it raw. Yes, I know, especially Mangaloreans, yes, your sambar pillai and all that, you all love to eat those. That is something else. But papaya leaf juice, See, when you're having a raw leaf, there are a lot of other chemicals in it that you don't know what they are. So a lot of patients, when they take the papaya leaf juice, severe acidity, vomiting, and everything starts. Liver gets even further strained. Now imagine you're having dengue. Over that, you're having vomiting. Over that, you're not eating. What is going to happen? You are going to get more sick. You are going to get more serious. And there is no evidence that the papaya leaf juice actually works in any form. Yes, there is the carry pill and this and that. It doesn't work. I never use it. I have never used it. Without it, you recover very easily. Give your body food, give the patient food, give the patient fluids, paracetamol. That is all. They will recover. Nothing more than that. There are many of you all who have had bad experiences with dengue. I do know that. Many people will say, oh, but no, I gave them the papaya leaf juice and then it went away. It didn't go away actually. What happened was they do the dengue test on the first day, on the second day. Then in that graph you saw, the platelet comes down. Platelet comes down, they start giving papaya leaf juice on the third and the fourth day. On the fifth day, what happens? The platelet goes up on its own. Goes up on its own. Oh, papaya leaf juice. No, it isn't. As a matter of fact, the papaya leaf juice causes a lot more. It causes a lot of acidity, a lot of vomiting. Really doesn't help. Kiwi fruits. None of us eat kiwi fruits on a regular basis. 90% of us don't know how to differentiate whether it is raw or ripe. Imagine eating a raw kiwi fruit. It is sour. Imagine having something sour when you are sick. Causes acidity, stomach burning, loss of appetite, vomiting. They become sicker. Another thing is they will force feed kiwi fruits. Four kiwi fruits in the morning, 4 in the afternoon. High fiber. If you're taking that much of fiber, what is going to happen? Your bum explodes. You get loose motions. So they have no benefit in giving. Everything else you can give. Papaya fruit. You can have fruit juices, musumbis, oranges. You can have no problems. But these two, avoid. I know there is a lot of it, especially WhatsApp is flooded with all of this, but just avoid it. Now, like I told you, the most important is the platelet count and the PCV. This is what I was talking about. Again, I'm just showing you this. Most people start giving the papaya leaf juice here. Why? Because they do the blood test and they find the platelet is low. So they give it here. Give it for 1 day, and what happens? The platelets are already going up on their own. So it's not the papaya leaf juice. It's just that the body is recovering. Now, what are the danger things to watch for with dengue? Now, typically, if the patient is eating well, adequate level of fluid intake, and is being treated properly, that is with just paracetamol and a vitamin tablet, this does not happen. Now, some of the danger signs you have to see is if the fever goes on for more than 4 days. Now, typically with dengue, the fever starts on the first day, second day there is fever, third day there is fever. Usually by the third day, the fever goes. And by third day, I mean you start from the time the fever started. So if the fever starts, say on a Tuesday evening to Wednesday evening finishes 1 day. So from Wednesday evening onwards, the second day starts. Tuesday evening to Wednesday morning is not 1 day. That is how you're supposed to count 3 days. If the fever is there for more than 4 days, then there is something else going wrong. There might be another infection. There may be typhoid going on. Maybe the patient is dehydrated. Go back and meet the doctor. Say that, see, it has been 3 days. There is still fever coming. Severe fatigue, in the sense, patient cannot get up. They are only bedridden. They don't have the energy to lift their heads. They are very exhausted. Babies, children, very lethargic, absolutely not eating, just on the bed like that. Don't wait. Go back to the doctor. There is something going wrong. Constant vomiting. If they continuously vomit, and this tends to happen a lot with the papaya leaf juice. too much of vomiting, they keep vomiting, they become dehydrated, the PCV starts to shoot up. Severe abdominal pain, especially upper left abdomen. So upper left, okay, because that is the upper left and the upper right, basically the upper abdomen. That is where you start having more pain, okay. Actually, I think I have made a mistake when I've typed this. Not left more, it is the right more because it is more with the liver. It means that is where there is a little more bleeding, so that tends to cause the pain. I will change that before I send it. It's supposed to be right. I'm sorry about that. Rash. Now, you all remember the rash I showed you all at the start of the talk. That was a nice pink rash. You press it with your finger and it leaves a nice print. And of course, I told you the rising PCV. This is the more dangerous rash in dengue. Now, basically what happens is this rash looks like goosebumps. You know, when you get cold or you get scared, how your skin becomes bumpy? When you run your fingers over it, you feel the bumps. That is exactly what this feels like. You have these red dots. When you run your finger over this, you can feel the bumps. If you can feel the rash, that is a dangerous rash. So anyone who's having dengue and you notice this coming anywhere in the body, typically usually upper arms and legs, go immediately to the doctor. Now, obviously, when patients get into danger signs, they are going to get admitted. Now, when a patient is admitted, they will transfuse only if the platelet count is less than 15,000. Up until then, they will not transfuse blood unless there are other complicating factors. A patient with an uncomplicated dengue with a little bit of dehydration or something, and the platelet count is more than 15,000, they will not give platelets. But like I said, these are not absolute rules. These are guidelines. So usually the rule is less than 15,000, then we transfuse platelets. Bleeding and shock. Shock means low BP, patient cannot get up, patient is semi-conscious. That is what we mean by shock. That is when we tend to give platelets. If there are signs of bleeding, especially the rash that I told you about, the rash on the skin or rash, the same type of rash in the mouth. The rash in the mouth is more dangerous than the rash on the body. Which platelets? Now, there are two types of platelets you get. You get single donor platelets. They are called SDP. And then you have fresh frozen plasma. Doesn't make a difference. Both can be given. The single donor platelets are a little more difficult to get. They sometimes are slightly more expensive as well. Doesn't matter. Does the blood group have to match? Oh, he's O positive. He must get O positive platelets. Not necessary. The platelets don't make a difference in terms of your blood groups. For the usual blood transfusions that we give for patients who are undergoing surgeries and all that, where you give the red blood, that has to match blood groups. This does not require so much. So that completes with dengue. So the dengue, simple thing. Once you're positive, once you're detected with dengue, you go home, you take paracetamol, take some vitamin tablet which your doctor has given, eat well, drink well, fluids, drink fluids, no alcohol, drink fluids, that's it. Wait for 5 days, everything will be fine. Respiratory infections. Now, respiratory infections basically means your respiratory system, the system that you use to breathe. The system that you use to breathe does not mean only your lungs. It starts from your nose, it goes to your sinuses, then it goes to the back of your throat, then you have your upper airway, and then you have your lungs. Now, any infection above this, that is from your nose to your sinuses to your throat, is called upper airway. Anything below the throat is the lower airway. I will tell you the difference between the two a little later. Now, what are the symptoms? We all know. Fever. It's an infection. You're going to get a fever. Cold. running nose, blocked nose. I can't breathe. My nose is blocked. I cannot sleep. My nose is blocked. We all have nose blocks. Headache, getting headache and giving headaches, both. Most of our people, when they have these headaches, they eat everybody's head at home. Headaches typically in the front. Head heaviness, especially if you have sinusitis. This portion feels heavy. You put your head down, you feel like your head is going to fall off. Throat pain, difficulty with swallowing, pain when you swallow. Cough, any type of cough, whether it is with phlegm or without phlegm. Now, please, by phlegm, I mean when you cough, what comes out? Many people use 1,000 different words from it. They say everything from coughum to cough. I have patients say, I'm having cough, but with a little bit of cough, not that much of cough is coming. And I have no idea what they're talking about. Phlegm. What I mean, when you cough and something is coming out, I mean phlegm. That is what I mean when I say phlegm. Breathlessness. Now, what is breathlessness? The simplest way for you to know what breathlessness means is when you are conscious of your breathing. See, we normally are not conscious that we are breathing. We are just breathing. No, this thing. The minute you are aware of your breathing, that is breathlessness. For example, remember the last time your nose was blocked. You're conscious about it. You know you're opening your mouth and breathing. That is breathlessness. Those of you who are asthmatic, the minute you'll start having the wheeze, that little effort, you'll become aware, oh my God, there is something, I'm putting a little more effort in breathing. The minute you're aware of it, that is breathlessness. How do you know if it is upper or lower? How do you know? The simplest way is with the amount of phlegm coming out. If it is an upper airway, you will get phlegm, but you will cough and cough and cough and cough, and that little phlegm will come out and you'll feel better. Lower airway, you do, and your whole mouth fills with phlegm. That is lower respiratory. So if it is lower respiratory, little cough, more phlegm. Upper respiratory, more cough, little phlegm. That is the only way to differentiate. It is the easiest way. And this is for you all to differentiate, not the doctor. The doctor will know. So please don't go and tell the doctor this. Breathlessness. Now, when you go and tell the doctor that you are breathless, you have to specify with the doctor, because sometimes the doctors may not ask this. You must specify that, see, I am feeling breathless. Why? Because my nose is blocked. I open my mouth, I can breathe. I close my mouth, I can't breathe. The reason why this is important is because if you are asthmatic, or if you are not asthmatic, but you're suddenly having a wheeze, or if you are actually having a chest congestion where there is phlegm built up in your lungs, whether you're breathing through your nose or your mouth, you are going to find it difficult to breathe. You are going to have breathlessness. You have to specify this to the doctor when you go. That, see, I'm finding it difficult to breathe through my nose, but I can breathe through my mouth. That makes it much easier. You go and tell the doctor, see, I cannot breathe. I cannot breathe through my nose. Even through my mouth, I cannot breathe. I'm struggling. Makes it very clear to the doctor that, yes, this is something to do with the lungs. Gurgling when breathing. This is especially for children. Okay. Now, many of you all have had babies at home. You all know that little when they're breathing. That is not gurgling. By gurgling, I mean they will be sleeping. And when the chest is going up and down, you will hear sounds like how, when you blow air through a straw, that glug, 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 that sort of noise. The noise that comes here when they are breathing, that is not this gurgling. So many babies, especially infants, all of you all will definitely remember, those who have had children will remember that when they were small, when they are breathing, that is not phlegm. That is just a little bit of secretions that are caught up there. But when the child is breathing and there is a gurgling sound coming from the chest, typically sounding like air blowing, like you blow underwater, that type of sound, and it goes with the breathing. That means that it is on the lungs. Children less than 1 year, what happens? Fast breathing. I will talk about fast breathing in a little bit. Fast breathing is something that is very, very important. In fact, Dr. Maria and I were just discussing how she came to know that her child was having an infection based on the fast breathing. Lethargy and inability to feed. This is very important for children, especially children less than 6 months of age. The child is put to the breast, the child suckles twice, then keeps quiet. Then it gets up again, it suckles twice, keeps quiet. That is because the child is being forced between breathing or feeding. They cannot breathe when they are suckling. So they suckle once, then they breathe. Then they suckle once, then they breathe. Why? Because the lungs are infected. The lung does not have the capacity to manage it. So the minute you have this lethargy with inability to feed, that is, they suckle once or twice and then they quiet, then they suckle once or twice and then they quiet, then there is something wrong. Subcostal retractions. I have a video showing you this. Fast breathing. Fast breathing is basically what? You're breathing fast. Okay? Fast breathing normally is not typical, no, nothing very significant in terms of for adults, because most adults will tell you that I can't breathe. Children is the more important thing. Children, you have to count their breathing when they are at rest. So if a child is crying, don't do this. The child has to be quiet. The child has to be on the bed, lying flat on the back, and the whole chest should be exposed. You will count the breathing for 1 minute. So you keep a watch, you count 1 minute, and you count the number of times the chest goes up and down. Up and down, one breath. Up and down, second breath. Up and down, third breath. That is how you count. Now, the rates differ. For an infant, that is a child between 0 to 1 year, the respiratory rate is between 30 to 60 breaths per minute. Up till 60 breaths per minute is normal. Between 1 to 3 years of age, about 25 to 40. So if your child is 2 years old and the breathing is 60, that is fast breathing. But if your child is 6 months old and the breathing is 60, that is more or less normal. Preschoolers between 3 to 6 years, the respiratory rate is between 24 to 34. I will be sharing this presentation with you all, so don't worry, you all will have this with you. School-going children, 18 to 30 breaths per minute. Adolescents, teenagers, 12 to 16. And 12 to 16 is also what is meant for adults. So if you have it, now mostly all of the adolescents, first of all, our adolescents will not keep quiet. They keep non-stop talking. And when they have this, they're definitely going to say, I can't breathe. So the breathing is the breath counting for adolescents, not so much. Infants, toddlers, preschoolers, and school-going children, very, very important. Now, this is what is the video of subcostal retractions. Now, when I play the video, what I want you to see is I want you to see what is happening here. Don't bother about what is happening to the stomach. I want you to see what is happening here. Now, can you all see this? This, where it is going in, I'll play it a number of times. See, can you see the breath? Every time the child breathes, this portion under the rib cage is going down. It's being pulled in. This is called a subcostal retraction. Now, if you have a child who has fast breathing for their age, which means whatever is their age, their breathing is going fast. And you see this. This definitely means there is a lung infection. You must take the child to the hospital immediately. The child has to be seen by a doctor very quickly. This is a very important sign. When y'all get this, watch this. Keep watching it. Y'all will see, y'all should be able to figure that when y'all see this in anybody's child, fast breathing plus this, you have to go to the hospital. This child is struggling. I'll play it one more time. This. So if you have a child with fast breathing and this is there, you need to go to the hospital. Now, what is the treatment for this? Now, here the treatment, most of our people who get colds and coughs and fevers, it is mostly viral. So for a viral, no antibiotics. No antibiotics. Mostly symptomatic treatment for the first 3 days. So you start having a fever, cold and cough, we give something for the fever. What do we give? Paracetamol. Fever more than 101.5, mefenamic acid. Okay. Second, you give something for the cold. You all know enough of drugs. Cetrizine, Monterelc, Mondeslor. You all can list more than I can list. You can give that. That's all. And you wait for 3 days. 3 days, again, counting like I told you. If it starts in the evening, that evening to the next evening is the first day. Then evening to evening, third day. After the third day's evening, if it has not come down, then you have to go and show the doctor. Go and show the doctor again. So if you meet the doctor and the doctor does not give you an antibiotic at the first time, the doctor is correct. It's a viral. Wait. Don't say, no, I need it. Because typically all viral infections, the first day you have fever, the second day you feel like you're going to die, the third day you feel like you may live, and the fourth day you're suddenly fine. That is how the typical viral infection goes for the upper respiratory. Most people, what happens, first day they have fever, they take Dolo. Second day, they're feeling worse. Like I told you, second day you feel like you're going to die. They'll go to the pharmacy. The stupid pharmacist will give an antibiotic. He'll give azithromycin. All of you will take azithromycin. Why? By the third day, it will go away. Do not take antibiotics, ever. Take an antibiotic only if your doctor deems it necessary. Please don't self-medicate with antibiotics. Then wait for 2 days to see improvement. And like I told you, by hours, basically, based on when you started having the fever. You start your fever in the evening, count it from evening to evening. And like I said, after 3 days, if your symptoms worsen or you're not improving, go back and meet your doctor. If they are improving, no problem. You're improving. No need to worry. Do not start antibiotics. Please don't. Do not go to a pharmacist and even if the pharmacist, no, take this tablet, 2 tablets you take. No. Tell him no. Give me something for fever and cold. No antibiotics. I promise you, 3 days, all your symptoms will go away. Now here is where, I'm sure my mother is rolling her eyes. Now, here is where a problem starts about saltwater gargling and steam inhalation. Most people believe, oh, throat pain, saltwater gargling is very good. Not quite, because this is why. Now, when you gargle, your water remains at this level here. Now, most of us, when we have a throat infection, it is here. This portion is what is irritated, your vocal cords. Now, when you are gargling and keeping the water here, it is not doing anything for this area. But the noise you have to make when you're gargling, it strains your vocal cords and then you lose your voice. So I always tell my patients, no saltwater gargling. But if you have tonsillitis, diagnosed tonsillitis, then saltwater gargling is absolutely correct. Because that time it remains here where your tonsils are. And that is when it helps. Drinking warm fluids is far better. That soothes your throat. Not hot, warm. Drinking warm fluids soothes this area a lot. Hot water hurts it. So warm water helps. Steam inhalation, you can do always. Plain water. Breathe through your nose, not your mouth when you're doing the steaming. And you need to do the steaming just for 2 to 3 minutes. You don't need to cook your face. 2 to 3 minutes, more than sufficient. Your steaming is done. Many people do tend to add Vicks or that Carvel Plus and this and that. Many people feel, oh, we feel much better when we take it. The reason why I have said that I do not want y'all adding anything is because there is a lot of overwhelming evidence that adding these chemicals tends to irritate the sinuses and the brain matter. So it tends to precipitate other conditions like migraines and everything. It tends to make them worse. So which is why I avoid, not I, all doctors preferred our patients to do steam inhalation with just plain water rather than with nothing, rather than adding anything. Now, urine infections. This is a very small topic. I just need another 5 minutes. We have all had urine infections. Of course, men are less susceptible to a urine infection than women for the simple reason that the distance from the outside to the urinary bladder in women is much smaller than for men. Men have additional pipes, so it helps. The distance is what makes a difference. So women tend to have urine infections more commonly. Like I told you at the beginning, urine infections tend to cause higher fevers. So that is also something you have to be aware of. If you're having urine infections, fevers are going to be a little high. Burning urine, passing urine more frequently. You go once, you come out, and then 2 minutes later, you have to run again. And then when you go, 2 drops of urine come out. That is a urine infection. Lower stomach pain, basically below your navel, and lower back pain. Now, lower back pain, it's not typically a pain. It feels like there is something on the inside of your back pulling forward. It's like a dragging pain. In children, especially children between the ages of 1 month to 2 years, loose motions and vomiting. Children having loose motions and vomiting not stopping is most likely a urine infection. Two tests that are done for a urine infection. You do a urine routine and a urine culture. Now, a urine routine, you get the report the same day. A urine culture takes 3 days. Every time any one of y'all has burning while passing urine, y'all don't even need to go to the doctor to give this test. Go to the lab, tell them I'm having this urine infection. I want to do a urine routine and a urine culture. Give the sample, go and meet your doctor after that. Do not take any medicine till you give this for testing. Because any medicine you take, for example, you all know that syrup Citralca, syrup Uricine, some of you all will know Urispaz, some of you all will take an antibiotic. It will screw up this report. And this report is very, very important for us to treat urine infections. So you'll have burning with passing urine, you'll are passing urine more frequently. Go and give this for testing before you take any medicine. That is very, very important. Best is if you can give your early morning urine sample. That is the best. But you can give it anytime. You can give it random sample as well. It's not an issue. Like I said, absolutely before medicines. And how to collect the urine? Early morning sample. Start passing urine. Pass urine for 1 or 2 seconds and then collect the center portion of your urine. I'm sure Dr. Maria will nod her head for this because that is very, very important. You pass urine for a second and collect the center portion of the urine. Don't collect the first portion of the urine. This is what you call an early morning midstream sample. So you take it the early morning, the first urine of the day and the middle stream. You can also use a random urine sample because say if you go in the evening to the doctor and the doctor says you can give the sample at that time also. It's not an issue. For people who have repeated urine infections, we do an ultrasound with something called, it's a kidney urine bladder ultrasound with a post-void residue. Basically, what they do is they make you fill your bladder. They see how much of urine is in your bladder. They make you go and pass urine. You come back and you repeat the scan and see how much of urine is remained. Some people have little urine remaining inside, which causes an infection. The treatment is based on your culture report. Your culture report will tell you what is infecting your urine, which antibiotic will work, and the doctor will treat accordingly. The treatment varies from patient to patient. Typically, normally it's a 1-week course, and then you repeat the culture after you finish the treatment. Same thing for children. It's the same thing. You give the urine for culture, wait for the culture report, start the antibiotics based on the culture, repeat it after that. But with children, you have to be a little more fastidious. So once the child is better, don't sit at home. The doctor has called you back to repeat the culture, go back and repeat the culture. Because if the infection is still persisting, it can go to the kidneys for children very, very quickly. It will cause a more serious infection called pyelonephritis. Basically, pus in the kidneys. This is my last slide. This is what I wanted to show you all about. Can you all see the marker? You all can see the arrow, right?
Yes, we can.
Yeah. So this is how a urine culture report comes. Now, this is what it shows. This is the bacteria that is infecting. The name of the bacteria is this. This is something called a colony count, which shows how many colonies are there. Now, sometimes we get a urine culture, which will show a colony count of, say, 20,000 or 10,000. That is not significant. That means it is not a very severe, that is not needed to be treated. It could just be a contaminant. But when you get a report like this, which shows more than 1 lakh or 1 lakh, more than 50,000, that is a significant infection. Now, over here are the list of all the antibiotics that they have tested this bacteria with. They have tested it against this. Now, here you can see it says sensitive, it says resistant, it says intermediate sensitive. Sensitive means this antibiotic can be used. Resistant means this antibiotic cannot be used. Now, this does not mean your body is resistant to the antibiotic. It does not mean that. I've had patients who come and say, no, you cannot use this antibiotic. It doesn't work on my body. No, it does not mean that. It means this. Now, for example, amoxiclav will not work against this antibiotic, this bacteria. That's all. So if you have this and it says sensitive, the doctor will treat with the appropriate antibiotic. Because if you take something that is resistant, it is not going to work. This is how you interpret this. All right. So that more or less concludes my talk. Do you all have any questions?
Now the forum is open. I encourage all of you, if you have any questions, this is a topic where all of us are very well versed with. All of us are experienced fevers ourselves or with our family members. If anybody has any questions, you can feel free to ask or write it in the chat box.
Test being done. I have a question.
Yes.
My name is Samuel Mohan.
Yes, Mr. Samuel.
For dengue fever, you have talked various tests, I mean, you said you had to, so you have to be very close to a lab, because quite a few tests, you said you have to get it done. And so unless a person is hospitalized or from home itself, it could be done.
They are done from almost all the labs. Every lab around, every lab can do the test. They are very, very routine tests. Your complete blood count is your simple CBC that is done for every test. The dengue profile also that I told you, the NS1, IgM and IgG is done at every lab. Every lab does it.
Okay, that's a nice SOP you are given, and we'll take note of that. And how long does the test take, doctor? I mean,
it varies from lab to lab. The CBC report usually comes typically within 4 to 5 hours. The report is ready.
Yeah.
The rapid report, you can get it immediately. Sometimes you get it as early as within an hour to 2 hours. The ELISA test, that is not the rapid test, the ELISA test takes a little longer.
I see. Okay. Yeah. And just one question is, I don't think it can. What is the difference between pyrexia and fever?
They're the same
Within,
thing.
it,
Pyrexia is the fancy name for fever.
I
When we
mean,
doctors want to sound very smart, we say you have pyrexia. When we want to sound very simple, we say you have fever.
okay. Thank you so much, Doctor. It is wonderful listening to you.
No problem. My pleasure.
May I ask a question, please?
Sure.
Can you throw some light on the color of the phlegm where they say that observe it if it is very dark green, they say it's an indicator for uh, infection. Is it true, doctor?
Yes, it can. See, infection, the infected phlegm can come can come in a variety of colors. It can come anywhere from light yellow to green. Now, green does not necessarily mean a bacterial infection. That is the only thing. Now, if you're getting a colored sputum, it means it is an infected sputum. Now, whether it is bacterial or viral is the difference. Now, if it is a viral, you don't need to be treated with an antibiotic. But if it is bacterial, you need to be treated with an antibiotic. Now, the easiest way for us to differentiate that is we wait for 2 to 3 days. Now, after 2 to 3 days, if you're not improving, then it goes in favor of a bacterial infection. But if it is improving, it goes in favor of a viral infection. Now, like I said, this is not a hard and fast rule. Sometimes what happens is if a patient has a bacterial infection, when they come maybe on the first or the second day, they are already very, very sick. They are already coughing. They are very high fevers. When we check the saturation is a little on the low side, then we might consider giving them an antibiotic immediately. It's not a hard and fast rule. But for a run-of-the-mill cold, cough, and fever, yes. And the color change, yes. The color change signifies that there is an infection. But it will not tell you necessarily that, yes, this is a serious infection. Because all colors, everything from yellow to brown to green, all of them say that, all of them show an infection.
Doctor, what is the percentage in terms of, see, my personal experience, whenever I have had cold, I did this, they say wait for a few days, invariably, then it still persists and I have to take a course of antibiotics as advised by the doctor, prescribed. I have
Okay.
seen this. I have seen this year after year after year. I get seasonal bout that once a year I must get cold during either the change of season from winter to summer or summer to winter.
Hmm.
And then I land up in a situation. So what happens is, why wait for 3 days of the suffering to avoid the secondary infection? And I know that what worked on me in the past, and rather not prolong my suffering.
But you said that you are getting this only about once a year, which does not mean that it is a very severe, not a very serious health issue. The problem is you getting it every time you have gotten it doesn't mean it's the same thing. You have gotten it from somebody else. Now, what that person has given you, we cannot say. It can be a viral infection. It can be maybe a virus that was transmitted to you. It can be a bacteria that was transmitted to you. The only way for us to differentiate it is this. What you're saying is completely correct. That yes, every time this happens, I wait for 2 days, it doesn't get better, then I'm put on antibiotics. That is exactly how we treat it. Because what happens is if you take an antibiotic at the first shot, we start having drug resistances. We have a lot of patients now who are not improving with antibiotics because all of the bacteria that is there in the general population is starting to become resistant to the antibiotics. For example, azithromycin. Now, abroad, azithromycin is a drug that is used in their ICUs. But over here, our people take it like chocolates. And it doesn't work anymore. No matter whom I give azithromycin for, it never works. So though I completely agree with what you're saying, that every time you get this, yes, you wait for 2 days and then this thing, and then it becomes. It is our standard way of treatment. It is a much, much better way of treatment because if you do improve without it, it is excellent. It improves your body's immunity because your body gets a better sense of what is infecting you. So Since you're getting it once a year, give it a little try. Give it a little, be a little patient. No problems.
Thank you, doctor. It's really very informative and it's a good learning there. Last but the least, there is a temptation to eat ice cream sometimes or drink cold water. After that,
Hmm.
so that
Eat.
it's
No problems.
there
Oh,
is nobody
you mean
around
if you eat an ice cream that
and
you will get a cold and a
listener,
cough?
you just open the refrigerator, have some chilled water, and throat goes for a toss sometimes.
Correct. So what I normally tell my patients to do is don't take extreme temperatures in the sense you go out, you're very hot, and then you come back and then you drink from the fridge. Don't do that. See, the body does not handle sudden change in temperature very, very well. So if your body is very hot and you drink something very cold, your body is not going to handle it. The easiest way when you come out now, when you're hot, you're tired, and you want to drink something, drinking something that is room temperature or slightly colder is fine. But drinking something directly from the fridge is not a good idea because that extreme change in temperature is what irritates the throat. Then you get an irritation. So it's a reaction that your throat gets. And because your throat is already reacted, then it becomes susceptible to get an infection. So you'll get that throat pain and that irritation for a day or two. And after 2 days, you get a fever. So
Thank you,
typically
doctor.
what I tell my patients is, especially when it is our typical summer, this thing, I tell them, if you want to drink cold water, take water from the fridge, half a glass of cold water, half a glass of room temperature water. Drink it that way.
Thank you,
Ice
doctor.
cream, ice cream, there is an age-old method that I follow, which my mother also used to tell. Do not take ice cream on an empty stomach. Have a good lunch, then you take an ice cream. Nothing will happen.
Thank you, doctor.
No. And another thing is if you're having something like cold drinks, for example, Pepsi and all that, put a pinch of salt in it. Put a
Oh,
pinch of
good
salt,
tip.
mix and drink. It helps.
Very good tip that is. Doctor, this helps for the chill beer also.
Here you can knock yourself out.
Good
No
one.
problems.
Thank you. Okay.
That's a great question.
I have a question, Doctor.
Yes.
Good evening. I'm Jenny, and I thoroughly enjoyed your talk today. My goodness, so informative, so clear, so well presented. Thank you so
Thank
much.
you.
But there's one question that I need to ask. Like my elder daughter, who is, of course, married and has a 1.5-year-old child, unfortunately, she was very, very ill during COVID. Okay. God's grace, she came through it, not having gone to any hospital or anything. But there was this cough that persisted and persisted for like over 8 months. And then we finally were told to see this doctor at Vikram Hospital. And he prescribed inhaler as well as something else, which helped for some time. But the moment there is any change in temperature, weather, or whatever, she is back to coughing all over again. And like you said, I think it's the lower respiratory, but it's a lot of cough with a little sputum. And until she throws it out, she's not able to get her breath back. And she's miserable. It's like endless coughing 20 times till she throws it out. And it's
Okay.
not once or twice in a day, it's like maybe 8 times sometimes. And I
And
really
is the
feel
cough
sorry for
more
her, but this
during
doctor is no longer available at the hospital and we don't know where to go. So the
is
poor
the
girl is
cough
struggling
is the cough more during the day or the night?
more during the day.
All right. Does she get a lot more? Does she get a severe bout of coughing when she lies down?
No, it just happens suddenly. I think it is some sort of allergen in the air. That's what I
No.
feel. Because it suddenly starts off.
Based on what you're telling me, you said that she was put on inhalers and the inhalers helped her a bit.
A bit, yeah.
Okay. It can be one of two things. Either she's having an irritation in the lower airway, which is causing her to cough. But like I said, if that is lower respiratory, she should have a little more phlegm. Not the way that you're describing, where she coughs, 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 and that little phlegm has
Until
to
she
clear
throws
out.
out that ball of phlegm, the cough doesn't stop.
Correct. So that most likely is something called a post-nasal drip. Basically, she's
Okay.
actually having a rather severe sinus issue. The
Okay.
fluid from the sinuses is draining down the back of her throat and
Okay.
falling on her vocal cord, which is causing that sudden cough.
Uh-huh.
And because it is upper airway, she gets a very small quantity of phlegm. And because it falls on the throat, on the airway, she will need a lot of effort to bring it out, which is
Correct.
why the cough is especially violent.
Correct.
So ideally for this more than a respiratory specialist, let her meet an ENT.
Okay.
The ENT will be the one who will be able to help her with this.
Okay. Because I was at a total loss what to do. I can't just bear her, to see her coughing constantly, practically every day. And with this little child, it's really not easy.
Correct. And
So,
it
since you
most likely
spoke
is
about
this.
the respiratory thing, I just wanted to seek your guidance on that.
So ask her to meet an ENT. That would actually help.
Okay. Any recommendations? Because she
Where
lives
do
in
you live?
Kamanahalli, she works at Vasant Nagar.
Kamanahalli. I don't know the doctors that side.
Vasant Nagar, closer to her office, perhaps.
I'll have to figure out. I'm really not sure. Maria, do you know anyone?
I
I
know
would
one in
really
Kamanhalli, doctor.
Please do
ENT.
recommend.
See, there is
She has
Dr. Vijay Kumar.
Okay.
It is Pratham ENT and Child Care Clinic. He comes
Pratham
with a very
ENT.
rich experience of
One
being
minute,
a
one minute.
consultant for.
One minute. She's looking for a pen.
Okay,
See,
okay,
I've got
sorry.
it. Pratham ENT.
And Child Care Clinic.
Okay.
You go and see Dr. Vijay Kumar, who
Okay.
was a specialist consultant at Malia for a long period when it was
All right.
operating.
Okay.
And he's very practical.
Okay.
So please see him.
And okay. And do you have a phone number or something of this place or the doctor, perhaps?
See, he's there on even Google. You put
Okay.
Pratham ENT and Child Care, you'll get the
Okay. If it's
directions.
available there, then I will get it. Yeah.
Yeah. If not, I can share the details. But give me your number. I can, in case, do that right away to
Okay.
you.
Okay.
Yeah. Please tell me your number.
97
97
390
390
72
72
787.
787. I repeat 973 907
90.
278 and 7. You are?
72787. Yeah.
Yeah. You're Mrs.
Jenny. Jenny.
Yeah. I'll do that, Jenny. Don't worry. Yeah. Go ahead.
Okay. Thanks. Your good name is?
Only name. I don't have
Your
good name
name.
and bad name. Mahinder.
Mahinder. Okay.
Yeah.
Thanks a lot, Mahinder. Yeah.
Okay, Jenny.
That's really helpful actually because I'm really at a loss to figure out who's
Don't
the right
worry.
one to let her see because she was consulting with this doctor and then suddenly there was no doctor at the clinic at the hospital. So
Don't worry. Your job is done.
thanks so much. Really appreciate your help and thank you again, Dr. Oliver and Dr. Maria.
My pleasure.
Been a real wonderful evening to listen to this absolutely amazing talk.
Thank you.
I agree. So
Doctor,
yeah, please go ahead. Somebody wants to,
Yeah.
Sherry, go ahead, Sherry.
Okay, yeah. Thank you, Dr. Oliver. This has been such an informative talk.
Thank you.
I just wanted to ask you a couple of questions regarding flu shots. One is like, do annual flu shots prevent or bring down the intensity of fever, like
They
especially when
do.
it's given to kids?
They do. They do.
Okay, and what I wanted to know basically, the question around it is we used to live abroad in Dubai where it has been the norm. So I have been giving my children like maybe for 2 or 3 consecutive years, I had given them the flu shot. Then we moved back to India, but then COVID happened, and we came during the second wave, and getting out and finding a good doctor and all that. Eventually, my kids have kind of grown. They have crossed age 10. Now they're in their early teens. So I just wanted to know: is it okay to resume the flu shots? Whether it'll
Yes,
make any difference? And
yes,
can adults also take them?
yes. It is very highly recommended for adults.
Okay, and so there's no problem, like, it has been given earlier, and if you discontinue it, there's no problem as such,
No, no,
right?
there's no problem. You can give it.
Okay,
Ideally, what we always recommend our patients is to take the injections only after November, because
right.
one, that is when the flu season is, and second, the flu vaccines are updated every year.
Okay,
They incorporate the latest flu strains. So
okay,
that usually is released sometime about September, October. So I normally vaccinate my patients only after November.
okay. Back in Dubai, they used to suggest, when the school started in September, no? That is when late September, around early October is when we used to give them. So it
They go in favor of their flu
weather,
cycles.
right? Okay,
Their flu
okay.
cycles, exactly. Ours, the flu season is more during the winter seasons.
Okay. Just what I, kind of noticed was, since I had given my kids the flu shot for about 2 or 3 years, and then when we came back to India, I noticed that somehow I think my husband and myself got COVID, during the second, not during the second wave, maybe towards that Omicron had started, but my kids didn't get affected despite the fact that we were in the same house, and we used to be like literally bedridden, but they used to help us a lot. The kids used to help us a lot. So does that have any bearing on the flu shot? Like, was COVID uh pro-
It might have had some amount of a cross immunity, yes.
okay, okay. Yeah, I just wanted to know that actually. Okay. That's informative, doctor. Thank you so much.
No problems. There were some questions in the chat, weren't there?
Yes. So there's an
Yeah.
adage, a starve a fever, feedback a cold. Is there merit in that? Any merit in that?
No. Always remember, anytime somebody is sick, the body requires help. The body requires energy to recover. You have to eat well. No matter what the infection is, you have to eat well. Because the better you eat, the more energy your body has to recover. And the same thing even goes for stomach infections, even vomiting and loose motions. Do not starve the patient. They need fluids. Give them ORS, give them light amounts of food, curd rice, dal chawal, khichdi. Make sure they're eating something. They need the energy. The body will not be able to recover based just on its reserves. So no matter what the infection is, please let them eat well.
Dr. While this is Shirin here again. Just sorry, just a
Hmm.
quick one. While you're on the topic of diet, sometimes they ask us to not give certain things. So, is like you're saying in the case of a stomach infection, is it okay to give them non-veg like egg or chicken or fish at least?
The thing is, I usually try to avoid patients from taking non-veg during stomach infections, because when
Okay,
you have a stomach infection, your body is already struggling. The stomach is struggling to recover. Now,
right,
things like eggs and non-veg are much heavier proteins, which require a far heavier digestive process. So
right.
what happens is when you give something like non-veg in an infected stomach and intestine, it can make it worse. So a
Okay, but
lighter diet would help
mhm.
that time.
But dals and legumes would be okay.
Yeah. That is fine. No
Okay.
problems.
Okay, okay. And even curd is okay in that case. Or like in the case of like a respiratory infection, when they're having a lot of phlegm, then I think all dairy should be avoided, right?
Not necessarily. See, I personally don't like milk. So I
Okay.
always tell my patients to not take milk.
Milk as such.
Everything
Okay,
else you
but
can find. And the salt thing actually helps. Now, if you're giving them curd rice and all that, put salt onto it and mix.
okay,
It helps.
okay. And even this thing about giving curd at night with some pepper should be okay, they say. Is that like,
For
is it
what?
true? Like if like my son usually loves to eat curd rice actually. I mean, on days when he used to be sick, he wouldn't have anything else. But a lot of people say you can't give curd at night. So then some people recommend you
Don't
crush
give
some pepper
cold.
and add it to that.
Don't
Because
give
curd
it
is,
cold.
don't give cold, okay? Like not refrigerated types, right?
Yes.
Okay, okay.
Warm curd rice you can give.
Okay, okay, fine. Thank you. Thank you so much, doctor.
No problem.
What about consumption of fruit juices and all during having a GI upset, like, you know.
See, that is the thing. If you're having the fruit juice without the pulp, that is okay. The thing is with the pulp is high fiber. So if you're having loose motions and you're giving fiber, it may make the loose motion worse.
Okay. I was talking from the point of view of the sugars. They say you're feeding the bacteria, and so it tends to get worse. So, cut short on any sweet, sweet. Don't
That
give
way,
fruit
even
juices.
ORS,
Is there any
even
merit in
OR,
that?
even ORS has glucose in it,
Right.
and we give ORS for all patients, so it doesn't make a
Right.
difference.
Right. My son's school is now telling me, ma'am, please don't send orange, don't send banana, don't send curd. He's having a running nose. And I asked, what should I send? Please tell me. Send biscuits, ma'am. So, okay. So is there really a relationship? I know, our elders kept telling us about certain foods to be avoided when we have an upper respiratory tract infection, you have a running nose, avoid these foods. What is your take on that?
See, the thing is, it all depends on what. See, there are some things that have merit. There are some things that don't have merit. For example, the easiest example I can give is in jaundice. Now, people who have jaundice, viral hepatitis, they say nothing, bland food, nothing else. It doesn't make sense. Now, what I tell my patients is yes, no non-veg, no oily food, but you can put some salt for them to eat. That is not a problem. Don't put overly spicy food stuff. But a regular diet he can have more or less. Heavy oily food, heavily spicy food, non-veg, you avoid. Now, similarly, in terms of colds and coughs, it is honestly just a personal preference of what you want and don't want. There is absolutely no indication of you not giving an orange when there is a cold and a cough, because by the old this thing, vitamin C is very good for cold and cough, and nothing has a higher level of vitamin C than citrus fruits. So they're telling you not to give it does not make any sense. And nothing is like bananas. Bananas are what? It's just a string of glucose molecules. How is that going to make anything of your cold and cough worse? People do say that no, what do you say? When you eat the banana, it becomes phlegm. No, it doesn't. You eat banana, it goes to your stomach, it's broken down, goes through your intestines, and it comes out of your butt as motion. It doesn't go anywhere into your lungs. This probably, my favorite thing is most probably what has happened is somebody ate a banana and then they vomited it out. And when they vomited it, they noticed that, oh, it looks like phlegm. Banana becomes phlegm.
Doctor, may I?
Yeah, please go ahead.
Uh, they say when it's cold, there is that brandy helps a lot. Is it true?
I vouch by brandy.
It's a personal favorite of mine, to be honest, but
Egg
I
flip.
don't honestly prescribe it. But for adults, a little bit of brandy and hot water does help soothe the throat from time to time.
My personal
We-
experiences, I've been through I mean, especially post COVID, I used to get these repeated bouts of upper respiratory tract infection, and I think I'm immune to azithromycin, and none of the antibiotics really worked. And then finally one day I'm telling my brother, I don't know what to do. This is absolutely irritating me so much. And he's saying, just take 2 tablespoons of brandy. And really, I was so fed up with the cough that I just took 2 tablespoons of brandy, just 2 tablespoons directly to my throat. And it worked like magic ever since. Now it's more than 3, 4 years. The moment I feel a slight irritation in my throat, 2 tablespoons of brandy directly to my throat in the night, and then I go to sleep, and it works
Dr.
really well.
Maria, put some honey in that. Honey. Soothing.
Magic,
It
That will
works
soothe
magic.
it.
very, it works really well. In fact, I've not taken antibiotics since a really long time. Just these two
What is
tablespoons
the
of
name of
brandy.
the brandy, Dr. Maria?
Yes.
Um, Morpheus.
Good.
Oh, okay, okay.
Use
Thank you.
Morpheus. Morpheus, yeah.
Goes beyond medicine.
Yeah, but unfortunately, we cannot really prescribe it on paper, can we? Though
Holistic
we,
healing.
No, but believe me, right from when I was a child, okay, we were given this concoction of 2 tablespoons of brandy, 1 tablespoon of honey, and a little pepper with a little warm water, and that worked magic for the children at all times, for their cough, for their colds, for anything.
It also has the added benefit of shutting them up.
That's true. I mean, they sleep right through the night, no hassles whatsoever.
That's why most of the parents are for it.
No, but I only used to give it at night because, the child breathing and coughing and, they can't really do much to sleep well at night. So, but I would only give them half that quantity at night, only if the cough was bad. But it worked. It really worked.
Unfortunately, as doctors, it's not something we can prescribe.
True.
And given
Absolutely true.
given my patients, they will directly, no, doctor told me I can drink, and that will be it.
Yes, and doctor will be out of business.
Out of business.
That is the beginning of the end for Brandy.
I wish it was the end of cigarette smoking and stuff that causes all these things
Was there a
most often.
question? I'm sorry, was there a question in the chat? Because something has happened to the Zoom and I don't know, I'm not getting the main page on this. In the chat, was there a question? There were two questions, I think.
No, so one was on the Starboard fever feedback, a cold, any
Mhm.
merit in that? And then you have a lot of compliments coming in. It was the next very informative, interesting talk. Really appreciate the clarity of the presentation.
Thank you.
Very helpful around to understanding the signs and symptoms of fever in children and infants. Good tips. So a lot of nice feedback, Dr. Oliver. There's one more message that has come in. Yeah, so personally, I enjoyed the talk. I can say that all of us really benefited from the talk that you have given, Dr. Oliver. It was
A lot,
excellent.
a lot.
Yeah,
Yes.
Thank you.
lot of very practical tips, right from picking up a fever, when to knowing when it is serious, when we need to go to the doctor, what to do. It was very, very useful. So thank you so much. Thank you so much for this very lucid presentation. I am going to read a small passage from the Bible, from Sirach, chapter 38, verses 12 onwards, where he says, "Then give the physician his place, for the Lord created him. Do not let him leave you, for you need him. There may come a time when recovery lies in the hands of physicians, for they too pray to the Lord, that he grant them success in diagnosis and in healing for the sake of preserving life. He who sins against his maker will be defiant towards the physician." The word of the Lord. Thanks.
Amen.
Be to God.
Thanks be to
God
God.
bless you, Oliver. It was wonderful.
Thank
Proud of
you.
you. Very proud of you. Hi, Oliver.
My parents.
How sweet.
Hi, Maria.
Hi,
Thank
hi,
you.
hello,
I get to
Auntie
meet
Janet
them.
and
Get to
Angel.
meet them sometime.
It is, well,
Your
Oliver's the
parents, I do
next.
get to meet them.
Thank you so much, Oliver, for giving us your time on this holiday on the weekend. Oliver is a really busy practitioner. He has his clinic on Sarjapur Road. It's a rural area, and he's treating many of the poor people there. He also
What a blessing.
goes to the orphanages around there and a destitute home and home for the aged. He's doing excellent work, has a huge clientage and very, very busy person. A Sunday
Praise
is,
the
I
Lord
think,
for him.
a Sunday
Thank
is a
you.
time where he gets to spend time with his family, and he has given this evening to us. Thank you so much, Oliver. Very much
Thank
So
you very,
appreciated.
very
grateful,
much.
Thank you,
Dr.
doctor.
Oliver.
Wonderful
Thank
talk.
you. Thank you very much.
We hope
Thank,
hearing it.
thank you and good night.
God
Good
bless you
night.
immensely.
Thank you.
Good night.
Thank you so
Thank
much,
you.
Doctor.
Good
And
night,
thank you,
all.
Dr.
It
Maria,
was
too.
wonderful.
Thank you, Dr.
Thank
Maria.
you.
Yeah,
Wonderful.
and thank you, Dr.
Thank you,
Maria,
sir.
as well.
Looking forward to the next
Thank
series.
you to all of you for joining, and
Thank
because
you
of you,
all for
we have
joining.
had
Yes.
this participation and active interaction. Thank you so much for making this meeting very lively, and we will come up with more such talks which are going to benefit all of us in our day-to-day lives. Please feel free to message me if you want any specific topic to be covered, and I would be glad to host it.
Will this be
So
connect?
thank you to
Thank you,
all of
doctor.
Thanks
you.
a
Bye-bye.
lot. Bye
Thank you,
bye.
doctor.
Have a
Thank you,
good
Good luck
Maria.
all.
Good night.
I'm at home.
Okay,
Yeah.
goodbye.